Okay, this is actually one of my favorite topics when it comes to teaching people on marketing techniques. So I want to be able to briefly talk about this to be able to start getting you guys to think about how you can improve yourself. Look, one of the biggest problems is being able to learn how to cold call people and how to be able to prospecting, to be able to know where to find the right people, the right physicians, the right referral sources, who they are, how to be able to identify them, and at the same time is ultimately cold calling them without them knowing who we are, or just walking into their office to be able to initiate a conversation so that they can start knowing about our organization. So, do you know who your potential prospects are? Do you know how to actually find the right physicians? Do you know how to be able to find the right nursing homes to work with? Do you know how to be able to properly assess them if they are a great source of patient referrals? So this is a lot of questions that a lot of home health marketers, a lot of administrators don't even understand. A lot of them will just say, go find a doctor. Or let's say you're a new marketer and you start working for a home health agency and the managers tell you just go out there and do what you need to do. Go out there and find nursing homes. Go find out independent living communities. Go find out hospitals. They just send you out there without any education. And this is one of the biggest mistakes a lot of agencies make, is that even the administrators, even the DONs, even the owners, the presidents, the CEOs don't even clearly know who their potential clients are. Who are their potential referral sources? You need to be able to literally put everything into perspective and know who you want to target at any given time. Look, a lot of people question this. A lot of people don't know this. So when looking for prospects, when you're starting to point out there who the people you want to target and you want to approach, you don't want to just approach all the physicians. You just don't want to approach all the nursing homes. You just don't want to approach all the independent living communities. What you need to do is to ultimately figure out who your target is and target that area. Each area has to be approached differently. There is a different marketing strategy for nursing homes. There is a different marketing strategy for independent livings. There is a definitely different strategy on how to target hospitals. Each one of these areas needs to be approached separately and use separate weapons or weapons that are modified for each one of them. Okay, you will innately have this answer, the answer of knowing the question of who you are marketing to, the moment you fully understand and are sold to your product first. You will see, once you are sold on your product, you will know all the problems that you can solve for each aspect, for each area that you are marketing towards. Right? From then on, you can then arm yourself with all the information you need to talk about and to talk to anyone and to whom you need to talk to about your services, about your agency. You need to know who you need to target. Like, for example, if you're targeting a nursing home, you need to be able to go straight to the administrator. If you're going to the hospital, you're not going to go to the administrator. You're going to go to the social worker, to the discharge planner. Every facility is different. Even if you're targeting a particular physician group, sometimes the physician don't even do the referrals. It's the manager of the physician group. The physician will just say, refer patient to home health, and it's up to that manager to ultimately find the home health that they want to refer to. Look, to be able to prospect out there, you need to be able to start learning what questions to ask, okay? You need to be able to know how to do this. And the next thing is you need to be able to be disciplined and learn the techniques on how to properly cold call somebody, how to be able to get past those gatekeepers, or how do you actually walk in without an appointment and ultimately be able to explain and find the right person you need to speak to. So, here's just the basics, and this is just the basics without touching on the part of any objections that you may face, okay? If you are cold calling someone, How do you cold call? Do you actually have a policy and procedure, a script that you have set up made for you? Or do you have a script made that you want to pass along to your new marketers, to your new liaisons on how to be able to start and open up a cold call? Step one, first of all, you need to leave all your fear behind, all your reservations, all your inhibition. Look, the fear needs to go out that door. And if the fear is, just tuck it under, the desk right now and just go at it. Until you can break past the fear, you won't be able to make that phone call. Look, here's one technique I've done, and I've known this in the past. The moment you made a decision, make a decision within a matter of 10 seconds. The reason for that is if you allow yourself allow yourself more than 10 to 15 seconds when you decide to create an action, your inner self, your subconscious will do everything it can to prevent you from doing it. It'll find other things for you to do instead of making that phone call. Remember, we've talked about fear in the past in home health marketing or anything that we do in life. Fear is non-existent. Understand that fear is nothing. There's no such thing as fear. It's actually just our bodies trying to prevent ourselves from change or from doing something that is different. Step two, you need to look professional. Look, you can't act professional if you're at the office wearing some pajama jeans or you're wearing some regular ripped up jeans and wearing just a regular t-shirt. Look, come prepared. If you're a professional, dress professionally. Look, I've gone to home health agencies and one of the first things I change is how people dress. Because if you look professional, you will act more professional and you'll project yourself with more professionalism. Step 3, map out several potential clients based on the needs of your products. If you're targeting, home health agencies right now, if you're targeting physicians, look, you need to be able to target which area or which niche of physicians are you going for. If you're trying to promote your PTINR machines that every nurse has one, and you want to present that to ortho physicians, and you want to present that to either, Coumadin clinics, then you've actually narrowed things down. Look, you need to be able to narrow things down rather than saying, I want to target physicians. Because if you just give a broad range, you're going to fail. You need to know who you're going to be targeting out there ultimately right away. The next thing is this. The next step is just go at it. Just call them. Remember, don't take more than 10 seconds. If I say I'm doing my cold calls right now, I sit down, I already prepared the day before, I have my list, I start making phone calls. Look, just do it. Either you just go visit them, all right, or you just start making phone calls. You want to be confident, all right, when you make that phone call. Be confident when you actually arrive there. And so part of the confidence to be able to help you and prepare you is our body language program. Because sometimes just by us changing our body language, how we position ourselves before we start a meeting, how we create those positive body poses, can affect us the way we present ourselves. Try this, for example. Why don't you, stick your chest out a little bit and sit up. It projects yourself differently. It makes you even feel better. Okay, rather than if you're slouching forward trying to make a phone call. The way you speak, for example, are you going to talk really, really slow? Or are you going to actually sit up, stand up, sit up straight and actually talk loud? And at the same time, it's project yourself of confidence. Look, you can project yourself with confidence, or you can project yourself like you don't know what you want in life. Look, everything that we do when we market is a specific science. For people that say that I will just wing things out, I'll just do what I feel, you will never be able to successfully calculate what has worked for you. By you being able to test the waters, and I've actually tested this myself just in body language and positioning, I'm ultimately able to present myself as confident because I am confident. So you want to be able to learn and just do it. Just literally, just like what Nike says, just do it. So, I have some amazing people that I've worked with, and I have some amazing people that I'm continuously working with right now in my organization. And they cold call everybody. And we actually cheer everybody out to help each other, to make sure we help each other help people. Look, my team of consultants, we go out there because we want to help companies like you. We want to be able to help people like you to better yourselves. Look, the complete belief in the fact that our products can improve the lives of agencies that we're working with makes us happy. Okay, it takes away all the fear of me trying to call you to tell you about our products. Why? Because I ultimately know that if you start using the Home Health Success Academy formulas and training programs, you will have a better successful company than the rest. It goes the same exact thing for you guys out there marketing your company. Once you've created a great organization, once you've created programs and services that will guarantee that your patients are taken care of, you will be confident to present that. And ultimately, when you go out there, when you make those phone calls, when you make those cold walk-ins, be confident and learn how to make yourself confident if you're not. Look, if you probably heard the term fake it till you make it. Look, if you're not confident, fake it. Create the body language. And ultimately, there is a study that's been said that just our body language can actually shift our pose of our mental state and behavior. By us just positioning ourselves in proper body language, it's going to make us confident in ourselves as well. And our body language is one of the nonverbal communication that is important. I've stressed it again. Take one of my video courses in regards to body language. Look, in our body language course, we're going to show you guys the techniques. Look, in communication, 7% is verbal. If you didn't hear this from me, you're going to hear it again. Or if you heard it from me and forgot, 7% is verbal or linguistic, meaning the words that you use, okay? Only 7% of communication. The rest is 55% body language, okay? And 38% tonality, on how you project your voice, how you speak to somebody, how fast do you speak, how slow do you speak, by matching and mirroring how they are, how their present tense is, how their present lifestyle is, the way they talk. If they talk really, really fast, you talk really, really fast with them. You want to pace people. Look, there are a variety of presentation skills that we want to be able to show you that's going to increase your influence out there. But you will not be able to see you won't be able to see success if you're not willing to take action. And really, one of the biggest action as a marketer is to what? Make those phone calls. All right? Stop making excuses. Pick up the phone and start calling people. And when you start calling people, do not tell me you only called one doctor today. You better have called 20 to 25 locations. In addition to that, you should have been at 8 to 10 doors. Look, don't plan your day where you're going to see a physician here and then have to drive an hour away to see the other physician. Look, there's Google Maps. Use it. Love it. There's GPS stuff out there. Use it. Love it. Make your day. Take your time and take that time and actually manage it. Look, time is money. The more you wait, the more another person is going to walk in and take that referral source. Look, you need to be able to prepare yourself. You need to be able to learn the techniques on how to be able to improve yourself. So cold calling, persuasion techniques, influence techniques, body language techniques, learning how to create programs and processes, learning how to use the right services in order to gain more referrals, in order to take care more of the patients, to have better quality outcomes. All these will tie into each other. But the first things first is to remove the fears and be able to understand that you are a marketer. You are a salesperson. Create networks. Go in there, take the fear out, start talking to them, explain to them the procedures, look professional. Okay, you want to look professional. You're not going to go in there with a wife beater. Look, you need to be able to be professional. Wear a suit if you need to. Wear a jacket. Wear a tie if that makes you feel better. You need to be more professional, more looking like a professional than the person that is trying to get that referral. You need to be better than them, that on any level, on everything as much as possible. Okay, so understand, cold calling is important. You need to be able to just decide, make that decision, walk in, speak to somebody. But at the same time, is prepare yourself. And we want to be able to prepare you guys on how to be able to handle objections. And at the same time is to handle even your own objections, because sometimes that is one of our biggest problems. We sell ourselves that we have a great product. We sell ourselves that we have a great service. Our staff is amazing. Our nurses are great. Our therapists are just the bomb. But then at the same time is we then object ourselves to our own objections and create this thing in our head why we shouldn't be calling people. Oh, I have to go ahead and call in for that medication for a patient, or I have to go ahead and call this doctor because he asked me for this one flyer. Look, you need to make the decision. Talk to the new people, right? While you're driving there, before you walk into the other physician, pick up your phone and email to them. Look, you have smartphones, right? If you don't know how to use your smartphones, then it's a dumb phone. Use that. I learned that from one of my mentors. It's an amazing technique. Look, your phone should be your office. You should have an iPad to make things better. If your company doesn't provide you an iPad, buy one. Why? Because you can afford it, because you are getting more patients. Stop making excuses. Pick up the phone call, knock in the door, whatever you need to do, start opening up problems. Let me say that again. Start opening up problems. Why? Everything that you do is a problem. Because if you're going into a physician to market to them, it's a problem. Because your problem is, I need to convince this person to give me patients. Look, you want new problems in life. Create new problems, but at the same time, solve it. And if you don't know how to solve those problems, call me, because I've faced those problems before and I know how to solve it. We're here for you guys. Give us a call. So once again, don't be scared. Just cold call people. Don't be scared. Just walk in. If you see somebody says there's no soliciting, say, I agree, there's no soliciting. I'm not here to solicit. I need to speak to Dr. So-and-so. Look, go ahead and claim it. There's so many things that you can do that we can teach you on how to handle all these objections. So you guys have a great day, and thank you for watching this video.